BPS, we are welcoming you to yet another session of The Brain on Wednesdays. I wish to inform you all, we have finished 1 year today. We complete a year of our program. This is the 23rd session today. And to speak on it is Dr. Bhaskar going to be there. To chair the session is Dr. Prasad Shetty. Dr. Prasad Shetty is a private practitioner at Bombay for the last 26 years, prior to which he was working with Pfizer for about 11 years. Dr. Prasad Shetty, the platform is yours. Kindly take over.
Thank you, sir. Hope I'm audible.
Yeah.
Yeah, it's a pleasure for me to introduce Dr. Bhaskar Mukherjee. Sir needs no introduction. He is an expert speaker on the brain. He's an expert in genetics and epigenetics. And the important thing is, sir makes sense of the clinical jargon sometimes which we hear otherwise. And like I said, brain consists of the the hardware and the software, and we psychiatrists are expert in the software. But Bhaskar Mukherjee sir is one who's both expert in hardware and the software, and today he'll be integrating both and making sense to us in this particular aspect. Over to you, sir.
So before starting, I would like to do slight recap of yesterday's the last week's talk so that you can get an understanding of where I am going. In first session of this series, I talked about illness behavior, the behavior that is exhibited by every animal who have a nervous system when they are under either threat of physical disease or threat of something in their environment. And this illness behavior is misnomer named as depressive behavior and obsessive behavior in human being. So what we deal with in psychiatry is actually a varied expression of animal illness behavior in human being, and so we are not only expert in human, we are actually also we should be expert of animal brains. Just like every other medical system has their animal branch, our system also has a animal branch, and we can trace the evolution from understanding of the illness behavior. So in first session I talked about illness behavior. In this second session I would talk about how brain evolved and why brain evolved, followed by I would talk about how and where brain started controlling everything in body, and then I would go about talking the specific multiple brains that are hidden inside the. Yes, ma'am. My voice was echoing. At this moment, is there any echo? I actually went back. That is why there was some echo. I hope there is no echo at this moment. So, lastly, I will talk about various brains that are hidden inside our body and how they correlate with central nervous system to create the human maladies as well as various other things. So with this, I'm going to start the session. I was going to create a unique presentation for this part, but unfortunately, due to today's workload, and I was in Delhi for past 7 days, so I couldn't do that. So I am repurposing one of my presentations. So first we have to understand while discussing brain that what is brain? Brain is the central processing unit of whole human body. We are just a walking, talking, moving brain hidden inside a biomechanical robot. So what is the job of this brain and how brain evolved to be like this? The job of brain is to maintain homeostasis. Now, what is homeostasis? Homeostasis is maintaining a dynamic bidirectional equation or bidirectional equilibrium between external environment and internal environment. And by doing that, the homeostatic process actually makes internal environment stable over a range of change. Our internal environment consists of various subgroups. For example, let's say our internal environment consists of pH balance, water balance, energy balance, temperature balance, and each of them are tightly controlled by brain to create a dynamic functional balance between external and internal. So how brain does that? In brain, there are centers for every internal environment system, be it pH, be it water balance, be it energy balance, be it temperature balance. All of them are situated in brain, specifically the brainstem, the medulla, the midbrain, the pons, and hypothalamus, plus extended limbic system or extended reward system. Both are actually synonymous. So these processes work in tandem to produce homeostasis. Now there must be an evolutionary process to that, and we would go into that evolution. In a single cell, this maintaining of these thousands of processes is actually very easy, because a single cellular organism has just a receptor, has a cell nucleus. There are various cell network, intercellular signal transduction network, that connect the sensor with nucleus, and in turn connect the nucleus with various effector structure. And when the unicellular organism senses some changes in the environment, that goes through the intercellular pathway to nucleus. Nucleus changes the cellular function, and that signal is carried on by again a group of intercellular signal transduction system to effectors. And as a result, the unicellular organism changes its structure, or take food, or take fluid, or moves away from one area to another area, depending on various environmental conditions. It is easy for a single cellular organism. But when this single cellular organism evolved to form a multiple cellular organism. This process becomes very complicated because one side of the multicellular organism does not communicate with the other side. It takes a complicated signal transaction to reach from one end of the organism to other end of the organism. So to create a fast information highway that would change this slow transaction, our body cells evolved to form nerve cells. These nerve cells in primitive multicellular organism creates a nerve net. That nerve net carries signal from one side of the organism to other side of the organism and create small loops of control centers which control different aspect of the internal environment. There is a dedicated loop for thermal regulation, a dedicated loop for energy regulation, a dedicated loop for osmotic balance regulation, a dedicated loop for pH and other thing. So there would be a multiple neural structure which would crisscross with each other to create this thing. That is the fast evolution of nervous system. And in this fast evolutionary stage, it is known as nerve net. This nerve net later evolved to form multiple peripheral loops of this controlling regulatory system which control various other parts. These peripheral systems are seen in the molluscus or cephalopods, where there are multiple nerve net, multiple loops, and they control each aspect of the internal environment. But as the organism evolved, it is found to be very cumbersome to create these regulatory loops and to make them stay in different part of body. That is not energy efficient. And evolution as well as biological science runs on energy efficiency. So evolution created a group of animals who has all the regulatory system in a single place. And that is the fast evolution of central nervous system. Once central nervous system is formed, then these all regulatory loops come within a very small space and it is easy for them to communicate with each other. Then, with further evolution, animal beings started communicating with each other and start forming complex colonies of organisms, be it lizard, be it arthropods, be it other mammals, they start forming various colonies. And as the colonies come into picture in animal evolution, these colonies needed sophisticated communication between these two members of the colony, and the reaction has to be instantaneous so that the communication can happen. For that, again, evolution needed to create a new structure which would enable this intercommunication between various regulatory loops. This new structure is neocortex. Neocortex is actually nothing but various regulatory centers communicating with each other. And as the social environment of these organisms become more and more complex, neocortex starts becoming more and more complex. And ultimately, in the age of anthropoid apes, means humanity, as well as chimpanzee, as well as gorilla and orangutan, in their when they started becoming more and more advanced, this neocortex starts becoming more and more advanced. And ultimately, various hominid groups, that is, human family groups, have started manifesting the most complicated neocortex in animal brain because these hominid groups have the most complicated social structure amongst all the animals. And that is how hominids start ruling of other animal and ultimately amongst all the hominid, Homo sapiens sapiens, that is we have gotten the dominance. It is not because we are gift of God or we are something extraordinary. It is just because we are a group of mammals who have the most complicated neocortex. That is how we became the current apex predator of Earth ecosystem. So this all became because of micromanagement of these regulatory brain processes and the need of evolution to keep the micromanagement very, very energy efficient. So, how this control is achieved? There are autonomic nervous system, there is neuroendocrine system, there is immune systems, and there is other regulatory nervous system, which come together to let homeostasis happen in body and which come together to let brain control the homeostasis process. Amongst the other regulatory nervous system, there is cortical regulatory nervous system, subcortical regulatory nervous system, spinal regulatory nervous system, and peripheral nervous system regulation. Each of them are responsible for various human as well as animal behavior. Each of them have role in various body system dysfunction and CNS system dysfunction. For example, let me give you some understanding by taking depression or rather illness behavior as an example. In illness behavior, what happens is homeostasis is threatened by a unmanageable load to brain. The unmanageable load might be due to something happening in the environment, be it social or be it physical environment of the organism, or the illness behavior is happening due to some changes in body systems. That might be due to infection, that might be due to autoimmune disease, that might be due to something else. So when that happens, the autonomic nervous system part of the homeostatic control becomes the instantaneous response system, and it starts manifesting by changing every organ function. It starts with changes in the respiratory rate increases, the tidal volume decreases, and there is relative air hunger. Then at the heart level, chronotropic action increases, resulting in increased heart rate. Then allotropic function increases, resulting in increased cardiac output. Both of these contribute to increased cardiac output of heart. When cardiac output increases, the resultant outflow causes increase in the blood flow of various resistance arteriole as well as various vascular beds. To control the increase of blood flow, these vascular beds starts contracting and the resistance arteriole starts contracting. That results in increased afterload and increased diastolic BP. So that is the cause of most of the time isolated diastolic hypertension, which is found in our patients of anxiety, but who are being treated by cardiologists as isolated diastolic hypertension. Then there happens to be increase in dysmotility of gastrointestinal system. In upper gastrointestinal system, when there is autonomic nervous system hyperactivity, there is stasis. There is also reverse peristalsis resulting in nausea, vomiting, and digestive disturbance. In lower gastrointestinal system, there is actually increased motility, there is actually increased secretion and various other things that leads to spasm, pain, as well as chances of diarrhea. Again, in skin, the same autonomic nervous system hyperactivity would produce increased sweating, and along with that, evaporation of the sweat would make the extremities cold. When afterload increases and there is contraction of resistance area, there is also diversion of blood flow from peripheral circulation to splanchnic circulation. This would result in cold and clammy extremities, which is found in almost all cases of autonomic nervous system hyperactivity, be it so-called anxiety, be it so-called hyperthyroidism, be it chronic infection where there is hyperdynamic circulation, be it anemia where there is hyperdynamic circulation, all would result in cold and clammy extremity because of that. In neuroendocrine system, the first thing we would notice is there is increase in all hypothalamic release hormone. So GnRH level would go from pulsatile to statonic high. TRH level would become high. Then all the other hypothalamic hormones, they would start increasing, resulting in increase of oxytocin, increase of vasopressin, and due to that, various organs would have various effects. Increase in TRH would result in increase in TSH, and so many of the patients would come with TSH around the level of 8 to 10 and would be conveniently labeled as subclinical hypothyroidism without understanding that this is just an acute phase response. And TSH is actually increased TSH, isolated increased TSH is actually a marker for acute phase reaction process. Similarly, corticotropin releasing hormone would also increase, and with increase of CRH, HK would increase, resulting in HPA axis hyperactivity. People would blame HPA axis hyperactivity without understanding it is just one of the neuroendocrine response. In case of GnRH overactivity, there would be, if the pulsatile release becomes tonic release, there would be menstrual disturbances, there would be skipping of ovulation, aneuploidy cycle, and that would lead to unerupted ovums crowding in periphery of ovary, producing polycystic ovarian syndrome, and the patient would be conveniently treated by gynecologists without understanding it's in the brain. We would discuss about these later, but I am just giving some examples. In immune system, there would be hyperactivity of immune system, and that would result in increase of illness behavior. So it is a vicious cycle. Illness behavior would cause immune system to become hyperactive. Hyperactivity of immune system would again increase illness behavior, and along with that, there would be increase in autoimmune response, increase in allergic response, and other things. In case of disturbed cortical regulation, the cortical behavioral phenotype would get aggravated or would become overtly manifest, resulting in various forms of either obsessive compulsive behavior or attention deficit behavior or other things. If there is disturbed subcortical regulation, motivation and limbic system drive would change, resulting in patient becoming either hyper motivated or there would be loss of motivation. Normally, in illness behavior, loss of motivation is more common. If there is dysregulation of spinal nervous system, then there would be changes in neuromuscular tone, there would be increased spasm, there would be increased chances of muscle pull, there would be a lot of spasms in various part of body, and they would be treated as fibromyalgia, they would be treated as muscular spasm, they would be treated mostly by pain medicine specialist or orthopedists. Again, without understanding, it is actually our part. So you see, we can explain almost all of the existing disturbances if we understand this. Now, this is a more complicated picture of that. And from here, we start to the body of brain. Brain and CNS through autonomic nervous system, neuroendocrine system, and immune system control all the various peripheral nerve conglomerates which work similarly to brain. Each organ has their own brain. Lungs has intrinsic nervous system which is mostly consists of autonomic nervous system which control every aspect of lung function. Heart has similarly exactly brain-like structure which control every part of heart function. Enteric nervous system is overhyped and overemphasized as second brain, but it is going to come as third or fourth in the number of brains rather than second. Then intrinsic nervous system of bone marrow would be the biggest brain of human body. It is larger than even CNS. If we think it that way, we don't think that is our problem. But intrinsic nervous system of bone marrow is a truly humongous brain because it consists of nerve supply to all the reticuloendothelial system, all the lymph nodes, all the various others. Now, I have actually mentioned them here and here, but this is for just understanding purpose. These two are same. So there will be also intrinsic nervous system of steel, which will be second in the size. Then intrinsic nervous system of whole vascular system, third in size, and every other organ, be it kidney, be it liver, they have their own intrinsic nervous system. And these intrinsic nervous systems are as complicated as our central brain. So we can be known as a body of brains. These brains are mostly self-sufficient. They get input from brain, they change their output and send one output to brain depending on how the local environment system is working. And these brains are as complicated as our brain, as our central brain, and these brains diseases manifest as rhythm disturbance of the organs, so-called organopathy. In heart, it is cardiomyopathy. In liver, it is non-alcoholic fatty liver disease. In lungs, it is interstitial lung disease. In kidney, it is the chronic glomerulonephritis. These are actually dysfunction of this intrinsic nervous systems of these organs. So again, if we understand this part, we would understand we have a say in every organ system, because ultimately it is brain which gives input to and which takes one of the output of these organs. So instead of neurogastroenterology, we should form the brain branch of gastroenterology. Instead of behavioral cardiology, we should insist on brain branch of cardiology. Instead of neurogas, neuro renal medicine, we should talk about brain input to nephrology and things like that. Now, having said that, what is the advantage and disadvantage of having this um, octopus trading its limb to every corner of body and controlling that? The central brain of this octopus that gets actually relieved by this peripheral brain, because then brain doesn't have to micromanage every part. That is advantageous part of it, and that also creates less of an energy demand for brain, because these peripheral brains are energy efficient version of the central brain, and they can manage the energy out better. But when CNS gets disturbed, these peripheral brains also get disturbed. So there can be no brain disease where these peripheral nervous systems are not into same dysfunction, and ultimately anything that starts in brain would end up in whole body, be it any neurogenetic disease manifesting as psychosis or mania or depression or whatever name we created for them. In them, the first dysfunction might be in the brain, but the ultimate dysfunction will involve both body and brain. And the reverse is also true. Their glomerulonephritis might start in kidney, but ultimately brain would get involved. Cardiomyopathy might start in heart, but ultimately brain would get involved. We can base our medical degree on the fact that a patient of cardiomyopathy would not die before the heart and brain both are involved.
अच्छा अच्छा
This is one example of the peripheral brain. This is intrinsic cardiac autonomic nervous system. It gets input from brainstem. It gets input from all the higher brain parts, and then those nerves enter the heart and create a very complicated internal cardiac brain which supplies every part of heart, create the rhythmicity of heart, create the various myocardial, endocardial, and epicardial responses, and ultimately they are the reason why a heart is working properly or not working properly. This is the more complicated picture, and this is the more schematic picture. This is the schematic picture, and I am highlighting it more because the complicated picture would be more complicated for you at this moment, because at this moment you are just getting exposed to the idea that our body has multiple brains and all these multiple brains are slaves to our original brain. So here, this is the cardiac brain. It is actually affected on by various sympathetic system and parasympathetic system. Then medulla has a role in this function. The higher cortical centers, be it prefrontal cortex, be it limbic cortex, be it hypothalamic area, they have a control over medulla, and through it they control this cardiac autonomic nervous system. Then medulla through spinal cord neurons creates another level of complexity on this sympathetic output, and through that the intrinsic cardiac nervous system. Then various brain structure as well as spinal cord neuron as well as medulla, all three actually creates various immune response, various endocrine response, which would again act on parasympathetic and sympathetic area to produce another level of control on this intrinsic cardiac autonomic nervous system. And this is same for not only cardiac autonomic nervous system, this is also true for enteric nervous system, this is also true for reticuloendothelial and bone marrow nervous system. So this is a very complex layer by layer control of brain over these peripheral brains. And all these, if are functioning properly, then no infection, no other disease would cause failure of our organ. The organ would be in the failure state only and only this whole system is not working. So this is what is the message of today, that how our brain and peripheral brains come together to form the homeostasis and to form the basic human as well as animal behavior. Now we'd go into practical explanation of each of them and how that can help us to understand it better. For that, let's come back to again some animal behavior. In this whole series, I would try to talk about animal behavior because in psychiatry, animal behavior correlation is never being done. In gynecology, in surgery, in every other branches of medicine, they talk about animal correlates and they talk about how animal correlates direct human behavior, human changes as well as how they are connected. In our system, we never talk about how we connect our system with animals. So we would first go to the grooming response of animals. I don't know how many of you have pets in your house, but anyone who has pets or who have had pets would remember that whenever a pet, be it a pet rabbit, be it a pet dog, be it a pet cat, whenever a pet gets disturbed by some disease or some change in their environment, they start grooming themselves more and more. Till there comes a stage when they stop grooming, get withdrawn, and stay in the withdrawn stage until and unless they are treated or the things that are offending them gets removed, and they may even die in this withdrawal state. So this grooming response, this overactive grooming response is the first stage of, or the rather most striking phase of the abnormality. If we translate that into humanity, this grooming response is manifested as anxiety, manifested as hyperactivity, manifested as restlessness, manifests as impulsive compulsive behavior, and manifests as anything that causes increase in goal directed activity. Then, when the organism cannot take this hyperactive state anymore, and their their brain reserves and body reserves get exhausted, they go into a stage of social withdrawal, physical withdrawal, and withdrawal from behavior. In animal, it is called behavior, illness behavior, sickness behavior, various things. In human behavior, humanity, in the past, they used to call it melancholia, bad bile, in the ancient part, and then around 1970, by discussion and with liberal use of BR, they came up with the name depression, anxiety, and things like that. Depression is actually a common language term which used to be used in the normal language to show that someone is feeling low. But during making of DSM-3, the people got the bright idea of turning sickness behavior into depression and created a depression entity. So we should call it sickness behavior or illness behavior rather than depression. That would be more appropriate, that would be more scientific, and in that way, we cannot be blamed that we are saying normal human behavior is pathological and we are making normal human emotion pathological. But I don't expect our classification system is changing that. And I hope by today's discussion, you have understood that it is just a complicated behavioral response that we treat to underlying pathologies which are mediated by brain, homeostatic disturbances, and dysfunction of various brains in our body and their intercommunication. In next part, we will discuss about another untold part of this dysfunction, the bioelectrical grid of all animal nervous system as well as animal cell system, and how the bioelectrical grid is getting disturbed to produce these symptoms. Once we finish these four, we will go into the system proper and we will dissect every aspect of our illness behavior to produce which produces all the psychiatric symptoms. I hope you have your questions ready.
Dr. Malay, can you take up the question answers?
Yeah, sure. Prasad. So at the moment, there is nothing in the chat box. So does anybody, if anybody with Dr. Prasad Shetty's permission would like to ask the question directly, you can raise your hand and ask. Prasad, you're not heard. Mute pe.
I said my permission is not required. They can start, you know.
Okay, so people can formulate their question. I have one question for Bhaskar.
Yes.
So when we talk about illness behaviors, so in the first half of the talk, you mentioned the various systems that are involved in maintaining the homeostasis of the body and the brain. And there were some of the things, I mean, each of those homeostatic mechanisms or system has got a early response or an immediate kind of a response, and then the responses remain over a period of time. So my question is, or rather my what I think, I mean, what is the time frame that this till what time would you call it an acute phase response? Then it would become a more chronic or a long drawn out response. And when do these illness behaviors become candidates for treatment?
Yes. When the illness behavior crosses the line between normal and abnormal and goes from physiological to pathological.
Yeah, so that is true. That is correct. But there are two aspects to this. One is what is the time frame roughly, and second is that are the acute phase responses different from the longer drawn out responses? So when do we start? So suppose
Yes.
suppose now I'm not feeling okay in general, let's say, or the sum of all systems combined, I'm not feeling okay. And I'm not feeling okay now since the last 2-3 days. So in terms of time, how long, and in terms of the quality, quantity, or intensity of whatever I'm feeling, what do I look at before I should consider that, okay, now now this needs to be treated?
Yes. The thing is, first we have to understand the acute phase starts as soon as the changes happen, and then acute phase continues for at least 1 month to 1.5 months. In some person with vulnerability, this may go to 2 months, and the chronic phase starts within few days, and that goes on for month. There is no time frame known to us at this moment that how long this chronic phase lasts. For some, the chronic phase gets adjusted by 3 to 4 months. For some, it is longer. And the interesting part is we actually cannot say at this moment with confidence that this is the time frame, this is the point when sometimes the physiological illness behavior becomes pathological. The base idea is actually more more than instantaneous is not the best idea, or cross-sectional view is not the best idea. Longitudinal view is the best idea to understand. If a person has vulnerability, then for that person, illness behavior persisting for 7 days should be treated. For example, if we see that a person is born with obsessive compulsive personality trait, is finicky about everything, gets destabilized very easily, shows frequent exacerbation of illness behavior or depression, whatever we can call it, then if the person is in that state for 7 days, that is that should be enough to start their treatment, because there is a lifelong chronic failure. It would happen always, so it is better to start their treatment as early as possible. If the person is otherwise doing not well, otherwise the person is working well, then due to sudden change in their either body or environment, they go into a exhibition of illness behavior. In them, we can wait for a month, or we can wait for at least 6 weeks before deciding that they need to be treated.
Okay. I have another question, but I'll come to that later on. In the meanwhile, Manish Roshan has asked 2 questions. I'll ask the first one first. He says he wants to know whether there are still changes going on how a human behaves or responds, or whether the brain is changing as evolution is an ongoing process.
Brain is changing. Evolution is ongoing.
Okay, fine.
Even so, illness behavior is universal. Illness behavior will always remain, because that is a basic animal response. Illness behavior remained unchanged throughout animal evolution. So, illness behavior would always remain. But what triggers the illness behavior? What causes a human being to exhibit illness behavior would change. Evolution is still happening in human beings. Again, we got new data in just 2 days ago that even today, the Tibetan plateau living humans, they show that there is recent evolution in them, which makes them more and more fit to live in the high altitude environment. So evolution in humanity is still ongoing, and if we compare brain activity level of today's people who are well conversant with various gadgets, various smart gadgets and other things, we would understand that their brain activity level, their brain connectivity level is different from the previous generation. So evolution is happening, and due to that, the various triggers for illness behavior would also change. But the illness behavior proper, that would not change, because that has been fixed for millions of years.
So the second question that he asks is that CL psychiatry, consultation liaison psychiatry, is the liaison between different branches of medicine. So with what we have learned from today's presentation, how do we define our role and how and when should we intervene?
First, if we are talking to other medical specialists, we first have to define our role. The expectation that we have created in others is that we would come, talk with the patients, we would find out some stress, and we would do a stress counseling, and we would go out. We have no role in other things. We have no medical role. We are just some counselors. So first we have to break the whole idea of me showing that brain is the central point of every organ dysfunction syndrome is to empower psychiatrists to say, again, we are a part of every dysfunction. So treat the dysfunction, but involve us. Because until and unless brain gets destabilized, no organ system can destabilize enough to produce a disease. So if our nephrologist is treating glomerulonephritis, then it is our job to tell them that glomerulonephritis is your area. We are not going to intervene in that. But the brain that is there in the body has surely suffered a blow. Otherwise, this glomerulonephritis would not progress. So let us have a look at the brain and let us try to help the brain, fix the brain so that the brain can handle the glomerulonephritis better. Similarly, in, let's say, cardiac disease, we can say to the cardiologist that cardiomyopathy is happening in your organ domain. But unfortunately, a patient who has cardiomyopathy is bound to have a primary dysfunction of brain which is allowing the cardiomyopathy to progress. So it is our job to treat that. That way we would be the central point connecting all the other systems. But for that, psychiatrist needs to be respected. Psychiatrists need to be well knowledgeable about every other body system, and psychiatrists should be confident enough. Unfortunately, these three combinations would take at least a generation to come up with. At this moment, psychiatrists themselves are not confident about it. So, how can we expect other medical specialties to trust us with the central job? We cannot expect.
Okay. Now, Dr. Ankur Singhal asks, what is this concept of abnormal illness behavior? So you mentioned illness behavior. So what is the abnormal, or
Abnormal
when
illness
does it become
behavior
abnormal?
means illness behavior persisting even after the trigger producing the illness behavior is gone. Illness behavior causing the animal being to become so destabilized that their life is in danger. Illness behavior is hampering the various other aspects of life of the animal. Illness behavior is threatening the place of the individual in the society. These are the abnormal illness behavior. Normal illness behaviors should not interfere with the life expectancy, the social place of the individual, or the other areas of individual. If that is getting hampered, then it is abnormal illness behavior.
Yeah, so the question that I wanted to ask as a continuation to what I asked you before is that what actually destabilizes the homeostasis of an individual? So my point is this, that clinically, when we see patients and they come to us with whatever, a neuropsychiatric presentation, a psychiatric presentation, the first thing they ask or they would like to know is what kind of caused it. So when we want to understand something, especially when, let's say, the external stressful situations are absent, then what is our hypothetical understanding of what causes the homeostasis to destabilize, or if it's destabilized, why is it destabilized for a very long period of time, and why doesn't it come to normal in some individuals or many individuals?
Because in our patients that we see, abnormal illness behavior is the norm rather than exception. We deal with abnormal illness behavior. We don't deal with normal illness behavior. Yes, there are some very well people who are showing let's say, normal illness behavior, but otherwise, as a rule, we deal with abnormal illness behavior. And abnormal behavior, illness behavior only and only can happen when there is a innate deficiency in the homeostatic control system. The innate deficiencies has to be there. Means the brain is not well enough to control every aspect of homeostasis. From birth, the brain is well, but the other system that connects the brain to other areas of body is not working well, or is both the areas are in problem. Then and then only this abnormal illness behavior would happen. So these people who are presenting to us with abnormal illness behavior, their full background architecture is in problem. So that is why any illness behavior in them goes into abnormal.
So
that is why longitudinal history is important, because longitudinal history would give us pointers that the homeostatic control system is not working.
Okay. Yeah. So any more questions?
There is
Dr. Bhaskar,
Yeah. So there is one more question.
may I?
This is from Dr. Manish Roshan. How and when we decide that we have to intervene?
We cannot decide, Manish. We cannot decide. We are now at the lowest rung of medical specialty. First, we have to convince our colleagues that we are not the lowest rung. We are at the highest point. We are the pinnacle of medical system. But to make psychiatrists understand this would be a Herculean task. Number one. Number two, to make psychiatrists fit for the job. The psychiatrist has to know every medicine. Means they have to start with Harrison. They have to know full Harrison. They have to have basic understanding of whole body. Then and then, with well-read, well-knowledgeable psychiatrist with no self-blame and no inferiority complex, we would be able to convince our people.
Sir, just one more thing. Like I've seen 2 or 3 small children. They are of 8 to 9 years of age, and they have this history of recurrent infections. But uh, they s- they were having some kind of anxious and obsessive traits. I started them on SSRI, and what I've observed that for the past 6 to 8 months, the rate of infection has reduced to 1 or 2 episodes only. So they have
Yes, that
suffered.
is the normal
So
thing.
okay, sir.
That you have done the right thing because you have fixed the abnormal immune response. That abnormal immune response was causing the illness. But if we start every psychiatrist on this understanding, it would not happen because psychiatry is now torn between psychiatrists trying to be medical and psychiatrists not trying to be medical. So first we have to create our own people in such a way that they want to learn medicine, they want to practice medicine, and they want to do medicine only. If we get our people in that state, then those people would be able to convince our other medical specialties that we are top medical system. Because it, I don't understand how it has happened, but the organ that is the main organ in human body is brain. The organ that is controlling everything in human body is brain. But the group of people who are dealing with brain, they have this medical understanding. That cannot happen. The psychiatry itself is a contradiction, is a oxymoron. The, the biggest medical subject with least medical knowledge.
Sir, just like
Dr. Vishal Sinha has raised his hand. Yes, Dr. Vishal Sinha.
Yes, sir.
Dr. Bhaskar, as
Yes, sir.
you have told about this, the central nervous system and intrinsic nervous system. So basically, we talk about the medical analogies, like all rheumatoid arthritis, multifactorial, any illnesses. Basically, if we take the brain as a central, which I also believe in that. So by managing like hyper glycemia, diabetes, so we are managing the intrinsic nervous system and the symptomatic presentation of the illness. But ultimately, we are not doing anything to rectify the fault that is having at the central level. So ultimately, the whole line of management is a fault.
Yes, ultimately, every diabetic patient needs a brain treatment. Otherwise, the diabetes would never be in good control and their progression would not stop. Similarly, that is true for ischemic heart disease, that is true for non-alcoholic steatohepatitis. If the disease is slow in them, then they don't have much genetic load. If they have real genetic load, then only and only treatment of brain supplemented with treatment of those dysfunctional symptoms can manage the patient. Otherwise, it is impossible.
So are we pharmacologically equipped with
Yes, sir.
armamentarium?
We have that armamentarium, but the problem is the armamentarium. About the armamentarium, we don't know ourselves. For example, the example Manish gave, he has treated people with multiple infection, small children, and they have better response. Their immunity is better. This is because number one, the brain vulnerability is getting fixed. Number two is every so-called antidepressant, every so-called antipsychotic itself, they are very, very good anti-infective agent. In fact, there are trials all over the world in labs which are trying to create treatment for superbug. They are trying to give antidepressant, antipsychotic as anti-infective agent. And there are multiple breakthroughs in this research. they have found out that all our drugs are broad spectrum anti-infective agent. So yes, we have the armamentarium. For example, our drugs, various, for example, SSRIs, they are good as anti-diabetic agent. But the problem is we have to know our armamentarium ourselves. We are not really very confident about our own armamentarium. We don't know our drugs. We are limited by our own terminology. SSRI doesn't exist. No drug work on serotonin nervous system. No drugs work on serotonin level. But we use the same terminology without understanding that fluvoxamine and fluoxetine, they may sound similar, but they are as different as any other few drugs.
So, but basically, this is the fault of the classificatory system, that we have classified them as working on psychiatric disorders, or basically as antidepressants, or as anti-epileptics, or these broad or false categories, pseudo categories that we have.
The category system of our drug is very faulty, sir. That has created a lot of problem for us and for patients.
Okay. Yeah. Over to you, Dr. Shetty.
No, that is Dr. Mukesh Batra has given.
He has given his...
Yes, actually, alopecia areata responds to antidepressants, as well as psoriasis responds to antidepressants. We have all seen those effects. So probably that patient of alopecia is due to some autoimmune alopecia. That is why escitalopram is helping.
Yeah. Dr. Malay, may I?
Yeah, sure. Please. All yours.
Yeah. No, I was just listening to what Sir was saying. I think we still have a long way to go for this clinical correlation based on the finding which Sir showed us. In practice, right from skin infections to recurrent cough, cold, and many other. Actually, there are studies where SSRIs have measured the diameter of the arteries and studied how the platelet count changes with exercise. So a lot of studies are going on. I like what Sir said. Right now, wherever I go, my name is in the last of all the consultants. That is there I've seen uniformly, and we need to go up the ladder, and we need to start speaking medicine, which we know better than physicians know psychiatry. So for me as a clinician, more into private practice and out of research for the last 2 years, that is one important point which Sir has made. And young psychiatrists who are there, I think they need to make their presence felt. And this gray area which is there has to be, made a little bit more black and white. And through liaising, we need to make our presence felt. And not only because we need to come into prominence, it is for the better health and outcome and quality of the patient care. So that's how I would put it. So, Sir, thanks for the presentation. I candidly accept that I could not understand the whole of it, but I'm much better than what I was before I joined here, sir.
I would say, ask me which areas you have not understood, and we can explain that.
Yes, sir. For keeping in mind, time is the essence, so we will require one more talk for that.
Yes.
Yes. Over to Dr. Rajkumar, sir. You're still there?
Yes, he is.
So, Malay sir is not responding. So, with the permission of the host and the co-host, can we?
We'll just hand over to Rajkumar, sir. He's there.
Sir is there?
Yeah, he's there.
Yes, he's there.
Sorry, yeah, he's there. My bad. So you are muted, sir.
Sir, you are muted.
Yeah. Sorry. Thank you, Dr. Bhaskar. Thank you, Dr. Prasad and Dr. Malay, for this beautiful session. Thank you, friends, for being there, attending this session. And we'll be meeting again after a fortnight for yet another session from Dr. Bhaskar. Thank you. Thanks also to Alchem CNS division, who are the knowledge partners. Good night to all of you and wish you all a very happy Diwali.
Good night.
Good
Thank you.
night.
Good
Happy
night.
Diwali.
Happy Diwali to all.
Thank you, sir.